Cherrybell, El Rio's Cherrybell Health Center. But before I get started, I wanted to thank the choir and talk a little bit about the choir. Of course. So this is, thank you choir for performing for us today. This is the El Rio Choir. And probably about a year ago, we decided that we wanted to enhance our health and wellness work. We all believe in the healing power of music. And so we recruited a choir director, Ben, and we're encouraging all of our employees, community members, anyone who would like to join the choir. They practice here at Cherrybell on Wednesdays at 1 o'clock. So we'd welcome you all. Pick up a flyer. I believe there are flyers around, and we'd love to have you. So thank you, El Rio Choir, on your debut public appearance. Johnson. I have the honor and the privilege of serving as the CEO for El Rio, and once again, welcome. Happy to have you all here today. This is a very exciting day for El Rio, a very exciting day for our community. And first, I'd just like to start by recognizing our elected officials and dignitaries in the audience, and I hope that someone did not sneak in that I am going to miss. First of all, Senator Andrea D'Alessandro, Cassandra Becerra, representing Congressman Ron Grijalva's office. Becky Freeman, Southern Arizona Director, representing Governor Ducey's office. Jonathan Rothschild, Mayor, City of Tucson. Richard Fenris, Vice Mayor, City of Tucson, a strong partner for this project. Councilmember Regina Romero, Ward 1. Ward 4. Pima County Board of Supervisor Ramon Valadez, another strong partner for this new health center. Dr. Reagan. Pima County Deputy County Administrator Jan Lusher. Our City Manager Mike Ortega. Our Assistant City Manager Albert Elias. I know he's here somewhere in the crowd. I think Consul Ricardo Menendez is here. Deputy Consul Enrique Gomez is here. I know Geraldine Martinez is here, the Director of Community and Cultural Affairs. So we're delighted to have you all here. This has been such a great partnership working with City and Pima County, and we couldn't be happier. I'm going to ask, we're so pleased to have you here with us. We have Pastor Grady Scott from the Grace Temple Baptist Church to start us off with a blessing.
Let us pray. The earth is the Lord's and the fullness thereof, the world and they that dwell therein. For he is founded upon the seas and established upon the land. Today, God, we come to bless this building. We ask that your presence would dwell here, and that all who enter through those doors may be helped. And Lord, may we never forget that we are each other's keeper. May we always remember that we share an equal responsibility. It doesn't really matter, Lord, how many of us come through the doors. We all are in the same place. So we ask for your guidance and your wisdom. May the people who occupy this building on a daily basis experience your presence. May they know they are doing your work in Tucson. Thank you for what you're doing. Thank you for allowing this building to take place. Thank you for blessing this community and bringing us together. And Lord, we look forward to the day when there'll be no hunger, there'll be no sickness, there'll be no suffering. We thank you. We ask your blessings upon everyone that is here. Watch over them and keep them is our prayer. Amen. Amen.
Recognize Dr. Francisco Garcia, our Deputy County Administrator. And now I have the honor of introducing the El Rio Health Board President, Enrique Serna, and we're going to let him do some special welcomes to folks.
Thank you very much. Thank you, Nancy, for giving me the privilege of identifying three other organizations, groups that I want to give special acknowledgement to. And I'll steal a line from Richard Fimbres. This is a great, great day, right? Thank you. The first of these groups is, of course, the El Rio Board of Directors themselves, and we have a great number of our board members that are here, and I personally just want to acknowledge them and thank them for their dedication and everything that we do as a board to make sure that everything that we do in concert with our leadership and our CEO provides for healthy outcomes for all of our patients, and that's what this is all about. So if I could ask you to, I was going to initially say you could stand up, but we're all standing. So would you all raise your hands, all the board members that are here? Thank you very much. The second organization is the El Rio Foundation Board, and we know what foundation boards do, and I want to acknowledge the president, Paul Hawks, is here. I saw Paul earlier. Paul, thank you very much. They are truly a lifeblood source for us in terms of, in the old days, we used to call it, you know, bailing us out of a big problem by providing funds, and now it's not so much that, but they're still providing much needed funds that we don't have budgeted. And this last year, they have a yearly gala to raise funds, and they provided us with enough money to buy a mammography machine for Cherrybell, which is here, and additional treatment funds for breast and cervical cancer. So thank you all very much. Appreciate it very much. So is there any other foundation board members? I'd like for y'all to raise your hands. Thank you. And I'd like to think of the next group as the Offspring organization, not their offspring, but Offspring organization called the Vecinos, which was the double shout out. A foundation board decided that they wanted to focus on helping young professionals get involved and orient themselves and become, people who would cry out on our behalf and attend to our needs. They also have a once a year fundraiser called the Bow Tie Party, and they were able to dedicate the funds they raised to dental services for children, which again was something that was not budgeted in our budgeting system. So without the Vecinos, and I think they're very, very close to raising the kind of money that the Gala does. So, I mean, they're doing good. So we look forward to y'all being on our board. The last shout out is to all the senior leadership and all the employees of our organization who live by a code. I hate to use that term given present things going on in the public, but a cultural belief system and vision and mission statement, those kinds of things that really creates an atmosphere of honoring patients first. And that's one of the many values that the organization lives by, and they demonstrate that and reflect that when people walk in the front doors. So that's my final shout out, and I appreciate that very much. And with that, I'd like to introduce Cassandra Becerra. Thank you.
How about that choir? So when I first got here and I asked Nancy, how did this choir begin? And she said it was employees and clients, and the wheels started turning in my head, and I said, well, I'm not willing to put in my notice at work yet, not until the congressman does. But maybe I need to become a new patient of El Rio to be able to be a part of that choir. my daughter's in the audience and she's like saying, no mom, no. Thank you so much. As mentioned, I'm Cassandra Becerra here representing Congressman Raul Grijalva. As a longtime supporter for community health centers and a friend of El Rio,
he is very sorry that he couldn't make it here today. Today is a momentous occasion for El Rio Community Health Center. The opening of the new Cherrybell Center is a testament to the talented leadership and hardworking staff at El Rio. El Rio Health Center not only serves as a gleaming example of one of the best community health centers in this country, but so many of our constituents are fortunate enough to call El Rio their home, their medical home. This new campus will continue the tradition of providing the top-of-the-line care for everyone that needs it, and I am especially excited that it will become a model for teaching health centers across the country. Community health centers are without a doubt one of the most pivotal components of our healthcare system, and one that our society could simply not do without. We appreciate all of the hard work that you have done to make today happen, but most of all, we appreciate the living care and the services that you have provided to so many of our constituents. This building is gorgeous, it's precious. I'm so happy that all of you are here today. The Congressman should be envious that he couldn't come here today, but we're gonna bring him. We're gonna bring him and he's gonna tour the center. So congratulations. This is a beautiful building, and all of the services that you provide to this community. Like I mentioned, we just couldn't do it without El Rio. So congratulations, and let's celebrate. And after all of the years that I've worked for the Congressman, which is about a little over 5 years, I have never had the pleasure of introducing the mayor of Tucson. And I am so happy that before he goes on to the next adventure of his life, that I have the privilege to thank you, Mayor, for all of that you have done for the city.
Thank you, Cassandra. And I don't think Raul's ever introduced me either, so there we go. Well, first of all, good afternoon. This is a great crowd. Enrique and I were doing a little talking, and one of the things we were talking about is how many really good people we have in the community, but how many are gathered here today. It's a real tribute to El Rio. Since 1970, El Rio has provided affordable, quality care to thousands of patients. And really, its business is to improve the lives of our community. Enrique and I were also talking a little bit about legacy. The two of us were first involved with this organization starting in the mid-1980s. And it was a whole different organization. And quite frankly, it struggled. And the strides it has made is just a great tribute to the community. And I know it's two things that we are probably most proud of. And so Enrique's done a lot more than he'll let on. One of the things that El Rio does so well is partner with the community. And a list of partners that El Rio has, and I see a whole lot more here today that aren't on this piece of paper, but include the Community Food Bank, the YM and the YWCA, Southern Legal Aid, Gospel Rescue Mission, just to name a few. A great collaboration with El Rio happened in the spring of 2017 when El Rio partnered with Tucson Medical Center to provide Health On, which is an integrated health and wellness nonprofit. It's sort of El Rio expanding out even further. At Health On, any community member can receive comprehensive services, including medical, pediatric, or behavioral health care. At El Rio, care is personalized. I can attest to that. Nancy is very proud of the fact that I'm an El Rio patient. I'm even prouder of the fact that all the care I've gotten at El Rio has been everything Nancy said it would be. Personalized, first class, and I don't think it's because I'm the mayor. I really, really do. Another way that El Rio improves community health is through education. El Rio has a long list of educational partners that includes all of our local universities, community college, but also some other national universities. But ultimately, it's about educating our community members. At El Rio, there are classes where you can learn better balance, how to protect your back from injury, exercises if you're a diabetic, and much more. The professionals at El Rio and the mission of El Rio is that the first defense against illness is education and self-care. You know, the other great thing about having El Rio as my primary care physician and place to go is I can even walk to my doctor now. So that's, and that's great for being downtown, but this location is perfect for El Rio. It is bringing to the community the services that the community needs. And Nancy, you and the entire El Rio group need to be highly complimented for that. I'm going to say one last thing that isn't on here because it was mentioned. I don't know how many years ago you guys would know, 6 or 7 young people came into my office and they said, we're going to start a foundation for El Rio. We're going to call ourselves the Vecinos, and we're going to be young people. And I go, that's a great idea, because I go to all these parties and everybody's over 60 years old. Good luck, have fun, see you. About a year later, they had their first party, which was over, it's now the El Rio complex. It was the blowout best party I've ever been to. But what it was even better about was that it was 600 young people in our community. Seriously, think about that. And the fact that El Rio could put that together and that cost could put that together gives me great hope for our community. So thank you, and thank you everybody at El Rio. I'm guessing by process of elimination, it is Nancy Johnson that's up next.
Thank you for those kind words, and thank you for all you do for our community. So I just wanted to give you guys a little bit of feedback about why we're so excited to be here today. So we began planning this project and working with the City of Tucson 3 years ago when the Broadway Boulevard widening project was announced and our Small Hills Center on Broadway, about 5,000 square foot size, I would say, needed to relocate. And as we began to have meetings with our patients and the community, we began to vision what this might be. You know, we were able to purchase this property from the City of Tucson. We had such great support from city and county government in helping to keep things moving really smoothly for us. We also were so fortunate to have TEP helping us. But along with the vision of many people here, I do want to call out Richard Spalding. Richard, are you hiding in the room? Richard, there he is. Richard has worked for El Rio for over 40 years. He has touched every one of our buildings. This building was his vision in working with BWS Architects and BFL Builders to construct this beautiful building. And what I like is that Richard has always had the vision. He just recently retired, but his vision is still present. He's still working on Cherrybell in some ways. But he really saw what healthcare should look like for our patients. And this integrated model that we brought from the clinical side, married with Richard's vision, has created this Cherrybell Health Center. So we want to, you know, on behalf of our board of directors and Team El Rio, we want to thank all those partners. And particularly, I also wanted to add Suntran in helping us with, you know, bus station issues that we're still working on, but making sure this was an accessible environment for people. This vision, as you most likely can see, and as you explore the building when we're finished here in just a few minutes, offers medical care for children through adults, offers a family medicine residency program. You heard earlier us speak about it being a teaching health center, so a family medicine residency program. We also have our healthcare to the homeless work going on in this center. We also have our SIA clinic, which is our HIV/AIDS clinic, which cares for more patients with HIV/AIDS than anyone else in Southern Arizona, approximately 1,600 patients. So all that medical care is going on in this building, but we're also delighted to have dental care in this building. And to be able to make that bridge between medical and dental for children when they come in for well visits, to be able to easily refer them over to dental, for our adult patients that need to have really good care of their mouths, to have that happen here. And wait, there's more. Also in this building we have behavioral health services, so that You know, all of us need tune-ups across our lives, and when we're able to say, let me introduce you to a counselor who happens to be right in this building. We also offer psychiatry in this building. We also offer general radiology, ultrasound, mammography. You heard about the wonderful gift from our foundation of the mammography machine. We also have a laboratory here, a Joint Commission accredited laboratory. And right around the corner there, you may have noticed there's a pharmacy. So this is really a one-stop shopping clinical care environment that we believe creates great primary care. And I would be remiss if I didn't acknowledge the little offices right behind there. I see some of our teams standing there that help people with health insurance, whether it's access to health insurance, setting up a sliding fee scale for them. Sometimes many of our insured patients bring in their EOBs and say, what is this? I don't understand that. Our advocates work over there as well as our referral sources. So we have a great support team here. And last but not least, we also have a program called Health Builders. So our patients and employees can take part in free health and wellness classes. You heard some of them mentioned earlier under Shelley's leadership over here. So we really see this as a community place. And we hope people will come for their healthcare needs and also to get healthier in other ways as well. So thank you for all that. And then it's my pleasure and honor to introduce Vice Mayor Richard Fimbres, who with his excellent staff and also all being our champion in helping us work with all the neighborhoods and getting to hear what the neighborhoods wanted in healthcare. So we couldn't be more honored to have your help and support.
Thank you all for being here. This is a great day for the city of Tucson and Ward 5. The next chapter of the Renaissance of the Ward 5 on the south side is here with this grand opening of the new El Rio Cherry Health Center, and we welcome it. The grand opening marks 2 years of work with El Rio Health to give Ward 5 on the south side this new medical facility. El Rio's Cherry Health Center adds 100 new healthcare positions, as well as having primary care for children and adults, lab, radiology, behavioral health, pharmacy, dental, and health and wellness classes. My aide, Mary Kuchar, from the Ward 5 staff, has a close connection to El Rio. Her mother, Yolanda Coronado, worked for El Rio for over 20 years. I am my chief of staff, Mark Kerr. Where's your hand? Give him a round of applause. Work with El Rio to coordinate meetings with the city of Tucson, coordinate meetings with surrounding neighborhoods and businesses, and to get them around the table to discuss the proposed health center. I want to thank Nancy Johnson, the CEO of El Rio, Enrique Serna of El Rio Healthcare Board, President, and the El Rio Health Center Board for their work and support of bringing the new healthcare facility to the south side. Nancy Johnson and the El Rio Healthcare are a key component also to the Tucson Homeless Work Program, providing health screening for people wanting to go back to work. And I really appreciate that, and thank you. I want to thank the city manager, Mike Ortega, our mayor, Jonathan Rothschild, and his staff for their work on the El Rio Health Center. I want to thank my colleagues on the council, Shirley, Regina, Paul, all of them that have helped us support this healthcare facility and the south side. I want to thank Supervisor Ramon Valadez. Raise your hand, Ramon. Give him a round of applause. I want to thank Suntran and TDOT for getting the much-needed transit stop at El Rio Cherry Health Center, and look forward to the completion of the stop that needs to be done. I want to thank Scott Clark, Director of Planning and Development Services, and the staff for their work for the El Rio Health Center and moving it quickly. I want to thank the neighborhood associations of the 4 surrounding neighborhoods, South Park, Pueblo Gardens, Las Vistas, and Western Hills for their support in this project. I also want to thank Earl and Sarah O'Neill. Raise their hands, give them a round of applause. Earl. Cindy Ayala, raise your hand. Give her a round of applause. James Christopher, raise your hand. And Willie Blake from Western Hills for all the work they did in helping this area. Not only here, but for the bridges and growing this whole area. when I was running, people said we need healthcare facilities in our area. And lo and behold, we have one now. And it's a beautiful facility. And I want to thank everybody that put this together. It's not one entity that can do this. It's a collaboration and partnership that everybody needs to work with. And I want to thank our board, the mayor and council. I want to thank the real board, their leadership, and I want to thank the community that came together to get this jewel done and completed. Thank you all.
So we are going to cut the ribbon, really. But, just a few little closing remarks for y'all, because I wanted to be sure that we recognize other important partners who helped us with this. So just so you know, and it's on the back of this little program here, if you happen to have that, and looking at the project cost here, the total project cost was $17 million. The project financing, the total project cost was funded through a $16 million New Market tax credit allocation from Corporation for Supportive Housing. And I know they're here today with us celebrating, and then $1 million in contributed capital, including the El Rio Health Foundation's donations as well. So this $16 million allocation was funded through a $10.5 million construction loan from BBVA Compass Bank with us today, and a $5.5 million equity investment from Wells Fargo Bank. So it does take a lot of partners, and you know, this is the first time we've ever done New Market tax credit, and our team worked so hard with this. I want to give recognition to Solaris Community Capital, who helped us with that process. And also, I really need to shout out to our CFO, Carlos Rico. Where's Carlos at? And Mark Raven, our counsel, because those two individuals spent so much time putting this together. It really helped. Our donors, as you can see, invested over $865,000 in this new building. So it truly is a community effort. So thank you all for that. I did want to also let you know this health center will be open from 7 a.m. to 8 p.m. on Monday through Friday, and on Saturdays it'll be open during the daytime too. So we'll have a lot of capacity to take care of people after work, after school, and avoid unnecessary emergency rooms and urgent care. So thank you for all that. So let's, we're going to invite you all to enjoy the building, explore the building. I know we have some folks that are tour guides. I don't know where they are. Might have to anoint some of you as new tour guides, I'm not sure. But we'll help you around the building. You're going to find subject matter experts scattered around the building. Our psychiatrists, we've got some medical directors, we've got our radiology manager. So there's folks around to tell you and answer any questions. But let's get some people up here to officially cut that ribbon. Thank you all. I think people know. Stay up here. Who else are we missing? Rahina?
She went back. She went back.
She had to leave early. Let's get okay, let's get Paul up here. Let's see who else do we need up here. Get some folks up here. Where is where's Gary at? BWS, is Robin back here somewhere? Usually I can find him.
You could text me your picture.
Gary, come on in.
Gary, would you have a chair downstairs so we can introduce?
I know.
There's Rob.
Who's got a wide angle?
Dominic, what did you do? If you're going to do the big official, do you need to be here?
Yeah, we want to see the bow.
Even though you're in the same room, everyone wants
Okay,
you gotta hold it tight.
Now we're going to go to video.
Can we cut the ribbon? You're in charge.
Everybody look here. Here we go. Here.
Help us count it down, everybody. We're going to start at 10, okay?
Hand it over to you.
This is a job for a professional. Okay. Now, hold on. 10 is too far. Some of these people that did not go that far to school. We'll settle on 5. Okay. This should be pretty good. I'm thinking the acoustics are great. They are. I'm not sure about this scissor, so to get this done, need a lot of help. Counting down from 5. Ready? 5.